How would my life be different without Julie? I think that I'm alive because of Julie. I had dealt with low iron for years, long before coming to St. Cloud. And it was Julie who said, we need to look a little deeper. We really need to find out what this is.
I've always thought of a family physician as somebody that treats their patients as if they're their family member.
When she was diligent in finding the answer to this low iron and discovering that it was some form of leukemia, I realized I had found a doctor who doesn't stop, who is not going to give up until the answer is found, and she sees that as her job.
I always try to put myself in that family setting because that's how I would want to be cared for if I were in the office.
Dr. Anderson has always made us feel like we're not being judged when we come in to see her. She gives us different examples of how she can relate to the way that we're feeling when we come in here.
In our practice, it's about our relationships. People are more open with you. They're more willing to share really what's on their mind because we all know that sometimes it's not a sore throat that you're really there for. It's something much more meaningful or more important. And if you don't cue in on that, you may miss it.
When I think about Dr. Anderson, I think about trust. I've seen other physicians throughout the years, and I've seen other specialists, and I think the difference maker is just the completeness of care and how thorough and what a compassionate listener she is to make sure that everything is going well. Not just an individual symptom, but the complete whole care is what she focuses on.
I have really enjoyed trying to make our specialty stronger because I really believe that the way to keep healthcare costs down in our country is to have a strong foundation of family medicine.
When I found out that Dr. Anderson was starting her own clinic, I knew it was important for us to follow her. I knew that the quality and compassion that she shows in her care was unbeatable, and I wasn't going to get that anywhere else. Her prices are transparent, and she holds herself to a very high standard that I know I would expect from a provider.
As a pastor in the community, I'm aware when people are struggling financially and maybe not getting the medical care they need because they have really high deductibles. The people I refer to who are struggling in that area are so very grateful.
I think, without Dr. Anderson's care, there would be so much more struggle, and that's what is amazing about her is that she doesn't jump to conclusions, but she really thinks things through, and then she explains to you exactly what she's thinking. So you feel confident in the process, but she really wants you to be engaged in that. So as a parent, that's super valuable to me that she's listening, but she's also engaging, and she's then, using her vast knowledge to put the whole puzzle together.
I feel a level of comfort with Julie that I've never had with another doctor. There is no white coat syndrome with Julie. She knows me, so she knows what questions to ask and when to ask them. I'm grateful for that.
We always are taught about the science of medicine, but it's the art of medicine that is the challenge, and that's what we all strive for. And I think that's what sets us apart in family medicine, because we have those relationships with our patients, and we're able to, because we know our patients, have more of those magical moments.